Good afternoon. My name is Bill Malecki. Dan Rosenman and I met 20 years ago when we both came out to the Bay Area to work for the hottest new startup, which at that time was called Stanford Surgical Technologies. If Dan were to make this introduction, he might have started by saying in jest, "Holy crap, I'm not even here and I'm carrying the weight of this organization." Like much of what I can remember, Dan couldn't have been more right on the mark. There aren't many others I know who could have been the nucleus of a new organization dedicated to the commercialization of new medical device technologies. The Rosenman Institute started out codenamed like most stealthy medtech companies. The code name was Friends of Rosenman. It referred to Dan's network of engineers, physicians, patent attorneys, regulatory experts, investors, who together have been involved in more than 100 medical device companies, most of which are Bay Area startups. However, there is a double meaning to the Friends of Rosenman, namely those impacted by Dan during his lifetime. The companies for which Dan worked couldn't have hired a more prolific or productive engineer. From his early days at J&J Ethicon, creating and patenting new applications for bioresorbable materials, through his time at Hartport, pioneering tools to enable minimally invasive cardiac surgery, to subsequent startups in the field of cardiology and ophthalmologic surgery, Dan contributed immensely to the intellectual property and technical leadership for the companies for which he worked. Dan was modest and would mask his accomplishments, such as the 30-plus patents, by redirecting attention to, say, his attendance record, never having missed a day of work in the 28 years he worked, which I think extends all the way back through his grade school as well. The entrepreneur was another friend of Rosenman. This time last year, Dan was consulting part-time, leading the effort to restart one medical startup while working with a physician on another idea, and at the same time volunteering time at the UCSF's Pediatric Device Consortium. Previously, Rosenman worked with another entrepreneur to start a company literally out of my garage in the Haight. Even though entrepreneurs are viewed as risk takers, Dan Rosenman was not. He simply had the confidence, knowledge, and experience to make any idea for a new medical device or procedure a reality. Today, many medical device professionals shy away from devices which aren't approved via a 510K. A few others would have undertaken the effort to develop a new device for ophthalmologic surgery, which involved approval from both the FDA and the Nuclear Regulatory Commission. Physicians and patients were also friends of Rosenman. Dan, like myself and many other medical device engineers and entrepreneurs, entered the medical device arena to work with physicians to develop the tools and procedures to improve the quality of life for people everywhere. Rosenman was conservative in assessing the risks and verifying the designs of the products for which he and his team made. I can remember one occasion when he asked me about a product I nearly finished. He'd say, "Bill, can you assure me with 100% confidence that it won't ever break during use?" To which I said, "Sure." Dan went on, "As a sworn witness, Mr. Malecki, understanding that the meaning of perjury, could you attest that the device will never break?" I gave this question a few more seconds thought and said, "It'll be fine." Finally, Rosenman made the point by asking, "Do you realize that a device failure will hurt the patient?" To which I finally conceded and said, "Okay, I'll run the silly verification test." The aforementioned conversation played back in my head months later while watching an early procedure using my device in which the physician applied far more force than could have reasonably been expected. And he wasn't even an orthopedic. So yes, physicians and patients who have never met Dan would consider him a friend. Finally, all those with whom Dan have worked during his all too short career would consider themselves friends of Rosenman. It's hard not to think of Dan and smile, remembering times when he made a room full of people laugh with just a few well-timed words. His sense of humor propagated throughout the engineering teams he managed and the companies with whom he worked. Eclectic is too ordinary a word to use to describe Dan's style. Some people in the audience might remember the velvet tuxedo he wore to a company holiday party, his vast t-shirt collection, diverse musical taste, obsession with burl wood furniture, or perhaps the authentic checker cab that he purchased in Ohio, flew out, drove back to New Jersey, then later shipped to California. Few might also know that he was also a card-carrying member of the Professional and Amateur Pinball Association. On more than one occasion, I got a call when Dan found a vintage machine tucked away in an obscure corner of the city. Rosenman also had a fascination with consumer products offered in late-night infomercials and took a stab at making a few of his own. Thankfully for many of us here, he applied his real engineering talents and ambitions to medical devices. Dan would be honored by the lasting impact that he'll make to the field for which he was so dedicated. I feel that I can speak for all the Rosenman Fellows in saying that we are the ones who are honored to be part of the Rosenman Institute.